morning, everybody. Welcome back to our Safe Together, Strong Together weekly update. Dr. Amy Bronson is here with me. My name is John Marshall. I'm VP here at Colorado Mesa University. We are taking our masks off for the purpose of this production consistent with Governor Polis's order, but of course we keep these masks on anytime we are indoors here at CMU to protect one another. It's been a busy week, and the COVID-19 roller coaster continues this week. Students are wrapping up their academic work. Most of that has been done remotely. A week ago, we came in front of you and said we were making a move to remote learning a few days early to do two things. One is to send students home with negative tests prior to the Thanksgiving break to keep families safe and really protect our community. And secondarily, it was to help speed up the handoff of our testing site to our community, which, as it turned out, has been a very necessary thing. Since last Friday, when we scaled up our testing site, we've accomplished roughly 4,000 tests, half of which have been for CMU, but 2,000 of those have been for the public and for the community. And so we're pleased that that testing continues to scale up. We're grateful to our friends at COVID Check Colorado, Emma Lienerman and Test Site Tommy and the whole team over there doing an amazing job as we continue to do that. That partnership with COVID Check Colorado, which has really allowed us to be successful with our testing strategy this semester, they're going to actually take that site over for about 6 weeks here and operate that as one of the sites in this community where members of the public can sign up, click on a link. I think we're going to provide that to you in the chat or maybe on screen, and members of the public can sign up, pick a test site, which is the CMU main site, and then pick a time slot that works for you. Wait time we've had is really just a couple of minutes, which has been really good. We've been able to turn those test results around within 24 to 48 hours. And so we just want to continue to encourage the community to utilize that as we wrap up our mass testing for students as they're heading home for break here. So that's a little about what's been going on here on campus. The other element that we've seen this week is the state of Colorado and Mesa County moving to red on our dial, and we'll talk more about that. But we know that CMU from the get-go has had a really unique arrangement with Mesa County. So Dr. Jeff Kaur joined us last week. We have a couple of guests here with us today to talk more about this. And of course, Dr. Bronson, you were one that really helped us develop these series of metrics and trying to assess what it is that we really need to be paying attention to stay safe as a community, right?
That's right. Yeah, we get really laser focused on numbers.
Yeah.
And I think it's really easy to forget that it's really about infrastructure and how we can respond. And yes, we are looking at transmission levels and what's happening around those numbers, but there's so much more to it.
Yeah.
And I think we could not have done it and really created a really thoughtful dashboard without the help of Mesa County Public Health.
That's the truth.
And I think that is a really great segue into one of our guests today is Andy Tyler, who's a regional epidemiologist with Mesa County Public Health and really has been the backbone of helping support what we've been doing here at CMU and really helped us to have a successful semester. So Andy, thank you for being here.
Thanks for having me.
Yeah, we know
Glad to have
this is such a busy time right now in the community, so we really appreciate you taking just a few minutes
Of course.
to stop in and say hello.
Hi.
Yeah.
Andy, we're with an audience that we get to chat with each week, members of the public, parents, students, faculty and staff. And, you know, a lot of times I think we all read the newspaper and we hear about all the epidemiologists and all the work at public health, et cetera. But you are one of the faces that's really been doing that work behind the scenes. And I think we're grateful for you taking a minute out of your day to come chat with us and put a face behind the name and really talk to us about some of the work that you do. So thanks for being here.
Sure. Thanks for having me. I appreciate the opportunity to speak to, a wider audience about this.
That's great.
Yeah.
So I know we throw around the word epidemiologist a lot, but I think for most of us out there, I've heard disease detective. What is an epidemiologist?
Sure,
What
yeah.
is your day-to-day job?
Yeah, disease detective, that's what my boss refers to us as, which I do appreciate that. Epidemiology comes from kind of the root words of studying what happens upon a people, and that's really what we try to focus on. There's a lot of different forms of epidemiology. Right now we're really of course in the applied epidemiology of studying what is happening upon the people of Mesa County, and so we were doing this work long before COVID came on the scene. There have been, of course, influenza is a major one, but there's all sorts of, if you hear about, say, an E. coli outbreak, well, determining where that came from is all of the work of local public health. And so what we have really been focusing on in the face of COVID is trying to identify who is most at risk, why are they most at risk, and then doing direct intervention and direct investigations with those who are getting sick with COVID, trying to find out where they may have picked it up from, and also who else they may have unintentionally exposed to the virus, who then could be at risk of getting sick, and really trying to stop that chain of transmission, which has become more challenging over the last several weeks to months, but I think especially for several months into this pandemic, just pointing to Mesa County's numbers especially, we were able to keep that spread at bay, and that was through the tireless work of our case investigation team and also the willingness and responsibility of the community to help to break that chain of transmission, as it were.
Yeah, and you talked about the willingness of the community to help break the transmission. What are some of those elements that help break the transmission? What are some of those behavior modifications that support that?
Yeah, it's not going to be anything new at this point, but it's keeping that distance, as you can see we all are keeping that distance right now. If you're not able to keep that distance, wearing a mask, the mask usage has really, I think some of the point of the mask usage has been lost over the last several months. What we know about COVID-19 is that people are highly infectious in the 2 days before symptoms start. So, which kind of sounds hard to believe, but what that means is people in the 2 days before they start having a fever, before they wake up feeling poorly or even develop a cough, they can be highly infectious with COVID. And so unfortunately, relying on just knowing, well, this group I'm about to be with, nobody's feeling sick right now, is unfortunately not good enough when we're trying to battle COVID-19. And so that's where the mask usage, if you are unknowingly infectious, that can help prevent you spreading the germs further. And then simple things like washing your hands for 20 seconds is incredibly important, which goes beyond COVID-19, of course, but certainly helps in the face of that as well.
Great reminder for college students, right?
Yes, let's just all do that.
Yeah, I think, focusing on that 20 seconds longer than you might think as you're washing your hands, but really keeping that distance, trying to really reduce the amount of time you are in close proximity to those who are outside of your own household. And unfortunately, that means your friends, that means your family, because it just gets back to those 2 days before feeling sick, people are infectious. And we know right now, especially in this community and throughout the state and country, we're facing a situation where there are more people than ever who could be unknowingly infectious. And so it's just important to take those precautions.
It strikes me, it's been one of those challenging things because so much of this coronavirus is something we can't see, right? We don't get to see it. And so the 2 days prior and not feeling sick and things that are difficult to observe. One of the things that is easy to observe, though, is our data dashboards. And we've all become sort of fixated on all these numbers and everything else. But, I wonder, Andy, if you might take a moment. We're all looking at these things, right? We look at the national data, and we look at the state data, and we look at the county data, and we, of course, focus on our campus data. What is so important about the various metrics? And how should we be looking at all of those metrics in context?
Sure, that's a good question, and I think, as you said, we have been and can easily be overwhelmed and overloaded with different numbers that are saying different things, especially, and you can look at any one data point to maybe try to make one case or another. But I think one of the main takeaways that I always have when I'm looking at any of the data, whether that be for example, percent positivity of amount of people who are testing positive, or the incidence rate, which is how many new cases we are seeing over a period of time, is what is the trend of those numbers? Are we seeing them increase? Are we seeing them decrease, or perhaps even stabilizing? For the last several weeks to months, unfortunately, we have been seeing them increase, and so. Things like percent positivity, the amount of testing that we're doing, how many of those are coming back positive. There, as I think we have spoken at length about, there is context that goes beyond that of who are we testing? Is it a random amount of people? Do we think this is a group that we think probably has COVID, and then we go and test them, and sure enough, and that can raise your percent positivity. But I think as we look at the national numbers, Mesa County numbers, or the numbers that are coming from your organization, CMU, what do they point to? Do they point towards a situation where we are expecting to see less people ill with COVID-19, more people ill, the same amount as maybe we would have a month ago, or not? And I think that helps inform me as to what choices I can make.
So it's both useful for us as individuals to be able to look around and say, at a macro level, how big of a problem is this in our community? Right. But maybe at a more micro level for planners, like those in the healthcare field and those in the public health sphere, to be able to see what's going on and to be able to make policy choices. Is that right?
I think so. It certainly can help. We at Mesa County Public Health and in the public health realm, it's our job to try to create the conditions that best serve the health of the community.
Sure.
And the only way we can really do that is have a good understanding of where the health of the community is at this point in time. And what we rely on, especially with these metrics, is not only seeing where we're at right now, but we have to be able to make informed decisions about where we're going. It wouldn't serve us or the community well to just make a decision regarding, the various levels or restrictions, things like that, without the data to back that up. And so we want to, rather than making it an arbitrary decision of today it seems like it's getting worse, we really have to use that data to inform those decisions to say, look, there are a number of different factors that indicate that we are seeing right now a worsening situation, and because of that, we have to try to take additional measures to help protect the health of the population.
Can you maybe take a second heading into the Thanksgiving holiday and remind us, here in Mesa County, where are we seeing the spread happening, and how can we, all of us, take an active role in trying to prevent that? Yeah,
that's a good question. Unfortunately, we're seeing spread in a lot of different avenues and locations. I think still a lot of spread is occurring among family. Certainly within households, we know, unfortunately, it spreads very easily. So if you have somebody in your household who gets sick with COVID, excuse me, there's a high chance that others in your household will probably get sick as well. We continue to see spread in just what I would have referred to, at least before COVID, as normal day-to-day activities, whether that's going over to a friend's house for an hour or two, riding in the car with somebody who is outside of your household, going to bars and restaurants certainly can help promote that spread. And again, the reason is because of people being highly infectious in those 2 days before symptoms start. So we're seeing it in a lot of different places. I think your point of going into Thanksgiving is a very good one, in that being closer than 6 feet for a long period of time is certainly risky. And I think I've sometimes gotten the sense that being exposed to COVID is thought of as a momentous occasion where you're exposed to COVID, you're going to know that this happened, when in reality it's just as simple as having a prolonged conversation with somebody who unfortunately is infectious. And so trying to think of it in that way, and how can I avoid that pretty uneventful interaction to help protect my health and the health of those around me is, I think, the best way to go.
I want to circle back to two things, because you hit on two things that I think are so important. You talked a little bit about metrics and how that can help inform decisions. but you also sort of hedge that in context, knowing that we need to have some context for that decision making. And you were really instrumental in helping us to build a dashboard that created context for our community here on campus that maybe is different in higher ed than it is, in other places. When we look at responses in a community, we're kind of a smaller village in a much larger community. So maybe take us back just a little bit, because it was really those sort of pieces and infrastructure that you helped us to create that informed our decision making. So maybe just take a few steps back, give us a little idea of how did you help us come to sort of those metrics that were going to be important for our campus, and what did that look like?
Sure, I appreciate that, Dr. Bronson. I think just thinking back to, it seems like a long time ago, but it really wasn't a long time ago. As you said, you guys are a smaller village within a larger community, and so really thinking about, and I think not only are you a smaller village, but you're a more, I guess, controlled village, as it were. You know the people who are here in your community more so than the wider population. And so because of that, it is important as we look to your population and to try to track, what is happening, that we put those in context. The percent positivity, I think, is a great example of conversations that we had at length about. We can't just put, I think, more arbitrary numbers and thresholds that go along with that sort of thing, because you guys have the great advantage of being able to do more targeted testing, for instance, to try to identify where there may be hotspots or clusters of illness. And because of that, that can result in, if we have a good idea that these 20 people have COVID and we're going to test them, and then we find a lot more of them have COVID, that percent positivity may be higher than if we did a random sampling, of course, of CMU staff and students and everybody in your community. And so just taking that into context to make sure that, I think what really stands out to me from our discussions and planning of the metrics was we wanted to make sure that we didn't allow one particular number or metric define what your response was going to be, what our response was going to be with you guys, but really trying to take what you guys know intimately about your community, what we're seeing with the data and the numbers, and be able to merge all of that together into a more, I think, responsible and effective response to COVID-19.
Absolutely. Well, we really appreciate your support in that. I think it did really set us up well to be able to respond and not react as we saw sort of the COVID landscape unfold here on campus this fall. So really appreciate your help and your work in that.
Yeah, certainly. We have certainly appreciated the partnership with CMU.
Andy, thanks for all your good work on behalf of the community. We very much appreciate that and taking time to come chat with us today. I know, Andy, if folks want to follow up that are watching right now or in the chat, maybe there's questions, what's the best way for them to follow up and ask maybe more detailed questions or continue to get information from Mesa County Public Health?
Yeah, I appreciate that prompt. We have our website, which is health.mesacounty.us, and there on our COVID data dashboard we have a lot of metrics that we've been discussing, but we also have a lot of specific guidance to industries, to people, of even how to care for yourself or other loved ones in the home who have COVID-19, that I think is very impactful. Beyond that, if you have specific questions, you can certainly give us a call, or you can email us at healthinfo@mesacounty.us, and we do work to respond to all of the questions that we receive with Mesa County. But beyond that, I think trying to watch these sorts of videos and just as we do press releases and do other media coverage, just paying attention to what we're trying to get out to the community, because we only want to put out what is most important and most impactful for the members of the community.
That's great. As we head into the holiday, what are those 3 C's that we should remember?
Oh, it's crowded, confined and enclosed, and close contact. So that's a good point, Dr. Bronson. I appreciate you bringing that up. It's those 3 C's of crowded, enclosed and confined, and then that close contact. And what you don't need to check off all 3 of those boxes to have a risky encounter. Of course, it just needs to be one of those, unfortunately. And so trying to keep that in mind, those 3 C's that, especially as we head into the holiday season, will be of the utmost importance.
That's great. Thank you for taking your time.
Yeah, we sure appreciate it, Andy. As we've chatted some about the work that we've done with Mesa County recently. I don't want to jump the gun. I know we're in real time in conversations with the health department, but it does seem to me bear mentioning that they have done so much work to really help us think about how this university operates differently than the broader community.
Yes.
A lot of different considerations, but I wonder, Amy, as we head into this coming week and the next few weeks, more changes are on the horizon, right? We're going to have to continue that conversation and think about what's next or
That's
something
exactly
like this.
Right. And we've talked a lot about what's happening in the community greatly impacts what's happening here on campus. And we know that that's going to continue to happen. We're going to continue to stay in conversation with Mesa County Public Health and make decisions that are not only good for our community here on campus, but the greater community here in Mesa County.
Well, thinking about the next steps and the next evolution of the pandemic, I know we've begun this conversation internally, but our next guest maybe can help us further this dialogue a little bit about vaccines.
Absolutely. It's in the headlines a lot, and I thought, this is a great topic to make sure that we stay on top of. So very excited to get to welcome Dr. Mike Reeder here today. Dr. Reeder is not only the medical director for the Physician Assistant Program, but also the acting director of the Monfort Human Development and Performance Lab, and so we appreciate you taking the time to be here. I think more importantly than your day job, you also have continued to be sort of the thrust behind our Medical and Health Advisory Board and continue to get really good medical literature in front of us to ensure that our plan has been on the cutting edge of science as we have began this planning. And I know as we are thinking about the future and what spring is going to look like, vaccines obviously are a big part of that conversation. So thank you for being here.
Yeah, I appreciate it.
Yeah.
I'd like to also say I appreciate the work you guys have done for the college and the community and as being part of the community. Not being an expert on vaccines, but really looking at them, I think it's it's going to be an interesting time over the next few months as they're rolled out, and I think people are going to have a lot of questions about them.
Doc, will you take a quick second and help our parents and students and others? Give us a 30-second thumbnail sketch of your career. You're a practicing physician and your background here.
So I've been in Grand Junction for 25 years. I was team doc here a long time ago when even John Marshall was here as a student. So
It's a long time ago.
Yes, it was. And I basically practiced in orthopedics, and then for the last few years I've had the honor to work here and be part of multiple different things.
That's great. All right, so vaccines are on the minds, but I think more importantly than just sort of the headlines of what vaccines are out there and what that could potentially look like, maybe let's dial it back just a little bit and do a little vaccine 101. Why are they important, just in general? And then what could the impact potentially be for COVID-19 as we think about the future?
Yeah, I think, when you look at vaccines, obviously they've been around for many years since smallpox, and they've really done a remarkable vehicle in public health and decreasing deaths, et cetera. And we don't really appreciate them because we all get them and we get this herd immunity and it stops things. So I think when I see it, even myself learning more about it now because we're so into this, I think vaccines basically they're usually taking a dead or deactivated virus particle or bacteria and put that and we give it to John, and John's immune system basically develops it so that if he ever is exposed to measles or mumps, his immune system attacks it immediately. So that's basically what we're doing. What's interesting about the two new vaccines is they're taking RNA, so it's messenger RNA, and basically telling John's immune system that here's what we're looking for, and his T cells tell the B cells to basically ramp up his immune system so that as soon as they recognize a protein on the virus, it'll attack it. That's the basic of an mRNA vaccine, which both of the Pfizer and the Moderna vaccines are. So I think it's going to be really interesting to see how it works. I mean, we talked before about the speed has been incredible. Usually vaccines take years to develop, and Dr. Bronson and I had this conversation. One of the things that struck me, though, is the people that are doing this have been studying this for like 20 years. It's not like they basically just started doing this in the spring.
Not their first rodeo.
No. And so the platform is already there. They've looked at coronaviruses before, amongst other viruses. So they've been preparing for this. And so that makes me feel better about the speed that they're doing. And a lot of people obviously are concerned about that. And that's real, but that's the way it is right now.
Doc, you talked about the speed. I think for a lot of us who are not medical experts and maybe don't have histories in the vaccination world, it feels like it's taking forever, right? Because every day that goes on, we don't have a vaccine. It feels like the economy continues to suffer and schools continue to suffer. But really, in context of vaccine development, this, as you referenced, this is like warp speed, right?
Yeah.
Can you tell us a little about that? What's a normal vaccine take to usually get up to speed?
Yeah, they're moving at light speed really now. They're doing a lot of things that normally would be sequential. They're just doing them in parallel
I see.
to try to decrease the time. Plus, there's a lot of cooperation and collaboration that maybe wouldn't have been done before because of economics and political things that go on. But that has really, there's been again a lot more cooperation that has made it go faster. And we talked a little bit about, generally they have a preclinical phase where they say, here's kind of in theory what it would do, and then they do phase 1 and 2. And phase 1 and 2 are with small groups, and they're looking at safety and like what would be the exact dose. And then phase 3, which both the ones that have been talked about, is with 50, 60,000 people. And they follow them for months. They see what their reaction is and what their possible side effects would be. And then phase 4 is basically following it after it's been released to see, we did it with 60,000 people. What happens if we do it for 1 million? What kind of symptoms do we see? And that's really what phase 4 is going to be.
Yeah, and it's interesting that a recent Washington Post article was just talking about really what it takes to go from the benches to the masses, meaning from the phases where we're going through all these steps to ensure that it's a safe vaccine, to really being able to deploy it out, to make it effective. Tell us just a little bit about what are those hurdles when we think about, yes, we have something that's going to be able to work, but now what do we do with that and how do we get it out to folks? Because as we'd like to say, vaccines are helpful, but it's really vaccinations that are important. So help us understand a little bit about what it takes to get over some of those hurdles.
I think the article is pretty interesting because they talked about how, so basically they're making these, they think go up with millions of vaccines by the end of this year and 1 billion vaccines by the end of next year. And in that, the article talked about basically putting them in these pizza-like boxes, multiple vaccines, but one of the biggest challenges, these 2 vaccines need to be kept at like minus 94 degrees Fahrenheit. And once
That's colder than my beer fridge,
yes,
right? Okay.
Yes, very much so. And if you put it in your beer fridge, it would only last for a few days. So it's going to be getting it out to the masses is going to be a challenge, and especially in less developed countries for sure. And there's a lot of hurdles to go through. So people are trying to figure out, and I guess dry ice is now a thing that they're worried about. How do we get enough dry ice, literally, because that's how they have to ship this around.
Wow.
And we're a community partner, right? So we are thinking about, obviously when we talked about infrastructure and COVID response and metrics and what all those numbers mean, one of those pieces is ensuring that our healthcare providers and workforce can continue to take care of those that need it. And I know that St. Mary's and community are starting to talk about vaccines and what that will look like. Maybe just talk a little bit about sort of strategy around vaccinations and where does that sort of look like as we start to get a few that are going to filter out to the community? What is that going to look like here in our community?
It's interesting. The health systems like St. Mary's and community have already started to work, and many have done it before this, on who basically gets it first. And so there's a tiered system, and generally healthcare workers who actually have a very high percentage of getting COVID. I just read a story that there was 30,000 people at this site of the Mayo Clinic, and like 10 to 15% of the people have COVID right now, of healthcare workers. So healthcare workers first, and then people in assisted living and nursing homes would probably be there. And then after that, it'll filter down to, essential workers and then eventually to the general public. So it's going to be a process. But I think the neat thing is there will be a time when enough people are vaccinated that we will start to develop some immunity, and hopefully that should slow the spread.
You mentioned the term herd immunity, and for those of us that maybe are following this a little bit more closely, that may feel more familiar, but just quick and dirty, what exactly does that mean?
So herd immunity is, basically I'll use measles as an example. So either you've had measles or you have the vaccine, so your immune system is ready for it. So I think it's like 95% of people have immunity to measles. That means that hardly anybody is going to be able to transfer that. That's why it doesn't transfer on this. Say if somebody had measles on this campus, but the rest of 98% of the people had immunity to it, basically that stops the spread. So, and there's been all kinds of debate about herd immunity and COVID, but the idea would be if people that have been exposed have had it, plus the people that get vaccinated, you'll be able to develop enough that, within a group, you're not going to be able to spread it.
Dramatically take out the spread.
Yeah. I'm thinking a lot about staff redeployment that we've had across campus.
Yeah.
We set up a mass testing site with folks that sort of moved away from their day job and became experts in a totally different field, whether that was testing or contact tracing. And I think about what that has meant to the success of our Safe Together, Strong Together plan and how important that has been to our overall success. And I think about what's happening with medical science right now. And Dr. Rader, you are so intimate with what is happening and kind of staying on the front lines of that. What does that look like in the medical community as far as innovation and people that are learning new things? And what will that mean for our community and our campus this spring as we head towards optimizing kind of our plans?
Well, I think that's still to be determined somewhat. I mean, I think it'll be how fast we can roll this out, but obviously everybody wants it to be tomorrow. And I'm not sure how fast it'll be, but it is exciting to see, and it's been fun to see, again, this collaboration and more of a cooperative feel, I think, in medical sciences when people kind of rally behind that. And, I'm hoping that, again, if you can get a big enough group that gets the vaccine, and then who knows, the coronavirus changes, and we could have a much better spring, and that's what we're all hoping for.
Yeah.
That's right. Well, we thank you for the advisory role that you have played and continue to play, and just your ability to be able to take all this new data and science that's coming together and make sure that we're pointing in the right direction. So appreciate you taking the time.
Oh, you bet. My pleasure.
Yeah.
Thanks, Doc. We know that as we develop into the spring and through the course of the winter, we'll learn more about the vaccine, what the strategy might be for deployment. I think for many of us, probably the best thing we can be doing in the next number of weeks is to continue to educate ourselves on what that means, so that both from an infrastructure standpoint and both from our own comfort levels, that we can grow our comfort and be prepared for that come spring, because we know this will be a vital part of our path out of this pandemic. So we look forward to that. Okay, so the favorite part of our show,
That's right.
if that's what this is, Q&A. So happy to take questions from folks out there that may have some.
I think as we have, wrapped around a lot of conversations today on metrics, testing, and then continuing to talk vaccine, all of those components are going to be what we're looking at when we continue to think about the future is now and what our spring will look like here on campus. And we know optimizing all of those things are going to be what is so important in ensuring that we are ready to come back with the strongest plan possible. But certainly as we're continuing to learn more, no policy decisions are being made yet on vaccines, because we're continuing to learn more every day. That's right.
I think recognizing that the vaccine conversation is one that we need to have carefully, and we need to have respectfully. And by that, I mean really appreciating that we are not the great and all-knowing oracle. We're all in this, figuring it out together. And so I think we tie back to that, one of those anchor tenets of this plan, which has been humility and recognizing that we can know what we know,
Yep.
but we need to have a respectful conversation about what we don't know as well, and really trying to navigate that carefully.
Yep. And we did get a question. We were talking earlier with Andy Tyler about, community gatherings and how easily spread can happen when we're gathering with lots of other folks. And we had a question just about disciplinary action for those that are hosting gatherings.
Yeah.
And so maybe we could just circle around on that a little bit and talk about what that's looked like on campus versus what's happening in the community around that.
Yeah, so we'll be respectful of our students' privacy, but I will say this: there's a number of students on campus this fall who got to meet and spend some quality time with our head of campus safety and student discipline because they were making choices that weren't consistent with keeping our campus safe. So we really have tried to take this educational approach, right, and helping students understand that. That's maybe not surprising. That's what we do every year. These are young adults that are getting an opportunity for the first time maybe to be alone and away from home and making choices on their own. So we are practiced at helping young people understand the impacts of their decision, but I would say we have been maybe a little bit more direct and a little more terse this fall with our students who have made some of those choices, because the reality is the stakes are higher and their impacts are affecting all of us. And so we have had to have some of those disciplinary conversations with students, and unfortunately, even some to the point where they're no longer students of ours. So that's not something that we relish, but it very much has been, as we talked about last summer, and continues to be one of our key guiding principles, which is we've got to hold each other accountable, and we've got to all be abiding by these safety protocols and the plans.
That's right. A really good question that has come in about our continual optimism about what spring will bring.
Yeah.
And will we be able to remain optimistic as we continue to see, community numbers and, potentially what's happening right now with closing down some of the freedom that we had and experienced on campus this fall. So just a good question about, will we continue to be optimistic? And I think the real sort of question behind that is, we're going to continue to do the work. And we know that that's not the easy choice, but we're going to continue to be in the trenches and continue to look for solutions that's going to allow us to have the on-campus experience that we all want. So I think the answer to that is yes. We're going to continue to stay in it. Obviously, we are mindful of what's happening, and we're going to continue with our medical and health advisory team to make the best decisions, not only for student safety, but for education and the importance of why we decided in the first place to come back on campus.
Yeah, great opportunity to remind ourselves that while we have most certainly been guided by values and our why, we're also paying very close attention to the dynamic data that we have access to. One of the reasons we built out such a strong tapestry of information is so we can make dynamic decisions in everybody's best interests on an hour-to-hour basis. It is what informed our choice a week ago to expedite a move to online. And it will continue to inform our choices as we head into spring. I sit here today, and heaven knows where we could be in 4 weeks. What I think we can all agree on is, let's stay in close communication. Let's be every bit transparent as we have this current term, and then we'll make good choices based on the best information we have, relying carefully on the experts, public health, medical, and otherwise, and their advice.
That's right. Yep. And we also understand the community landscape impacts that. And we came into the fall with a community landscape that looks very different than our current community landscape.
That's
and so
the truth.
Certainly that continues to be a part of our decision making as well.
Yep, absolutely.
Yeah.
We had some questions about Hawaii, and we recognize the state of Hawaii implemented some really unique testing requirements. We have, as soon as we saw that, we began a conversation with our partners and the various labs involved, because we know that our test meets their criteria.
That's correct.
But our labs have to go on this approved list, right?
Yep.
And so that the first part is yes, the second element of that is we're working on it.
That's right. And I think just it goes to show that, to emphasize, it's not that our lab is not a trusted partner. It is. It's doing over 2% of all the COVID testing across the nation.
It's a lot.
It's a lot. It's a trusted lab. It just doesn't happen to be on that list. So we are working towards that. We understand that we have a lot of folks that impacts, but want to reassure folks that NAAT, or the nucleic amplification acid test that they request, is the same as our PCR test that we run here. So that is the same. It just has to do with the lab partnership and approval by the state of Hawaii. So it's a great question, and we are working on it.
All right. Wendy, thanks so much. We appreciate your kind well wishes. I know Dr. Bronson probably won't take a vacation, but I am going to take a couple of days off. And we appreciate your kind well wishes very much. It has been a long semester for everybody on campus, and I know many of us are looking forward to getting a couple of days to spend with family and rest.
That's right.
Because the work continues, and we're excited about that coming next semester.
Yep. I also wanted to let Terry know our Residence Life team will follow up with you after the show. So hang tight. We will get to you and get to that answer. So,
yeah. I might just say at a macro view, because of the fact that we have had a number of students test positive in the last 2 weeks, a lot of you are dealing with individual cases that are nuanced. And one of the reasons why we built the system that we have is so that we can make good choices based on your unique circumstance. So if you have a situation that you're saying, I'd really like to talk to somebody a little bit more and understand our family's needs, and my student is isolating here, and exactly what is their circumstance, and maybe they're asymptomatic, or maybe the onset was X. Those kind of details, we really want to engage with you one-on-one. Send us an email at safety@coloradomesa.edu. That's safety@coloradomesa.edu, and let us work with you. You can also call our main line, which is 970-248-1366. That number will get you into the student services team, which is kind of where our COVID team is embedded for the time being. 970-248-1366. We're happy to ensure that we've really looked carefully at your student situation and are making good choices as a result of that.
That's right. We talked a lot in this last segment about the future is now, and where are we headed in the spring. And I don't want to neglect or forget to just stop for a moment and pause and be grateful for what we do have and where we've come from, because I think in this time of Thanksgiving, we do have a lot to be grateful for, and a lot of that is your partnership and willingness to be in the boat with us and help us to be at this point. So we hope you take some time, enjoy family and friends in whatever component that looks like. I know with COVID, it looks a little bit different, but I hope we can all take those moments because we do have a lot of gratitude for you being in this with us.
Yeah, and grateful to have this semester, but for a few days here at the end of the term, we were able to accomplish what we set out to do together, and that's really a credit to faculty, to staff, and to our students who bought in to do this. So really grateful that we have had the semester that we got to have together. That's a pretty special thing. Not everybody around the country got to have that.
That's right. Yeah.
Well, we're all, as always, grateful for the entire community, parents, faculty, staff, students that make up Colorado Mesa University. And so be well, enjoy your weekend. If you're willing, tonight, President Foster is going to host yet another teletown hall. So if you get a phone call from a 970 area code tonight during dinner, it is not a political call, I promise. It's President Foster calling to chat with you about what's going on campus. So join us for that, if you will. Other than that, be well. Thank you, and we'll see you next time.